For the first 2 weeks, your cardiac surgeon is considered your primary physician. If you are having any problems, you will need to call them first. The numbers are listed in the discharge instruction booklet. You will need to schedule an office appointment for approximately 2 weeks after your discharge. We also want you to notify your family doctor and your cardiologist of your return home. They may want to schedule appointments with you for a few months after discharge. After the surgeon releases you from their service, it is your family doctor and cardiologist that will be responsible for your long-term care. Your floor nurse will go over the list of medications that you are to take when you go home. These are the only medications you should take. Do not start, stop, or change any of the dosages you have been prescribed. If you have a question about a medication that you were taking before surgery, please discuss it with the cardiac surgeon or your nurse before discharge. You should avoid over-the-counter medications for the first couple of weeks. If you are having any symptoms, call your surgeon before taking any over-the-counter medicine. This includes vitamins or supplements from a health food store. However, you may take milk of magnesia or a stool softener for constipation or plain Tylenol for pain. You will be given a prescription for pain medicine. Take this as needed. You may find initially you need it more at home because of your increased activity. At bedtime, we recommend a full dose to help you get a good night's rest. If you have any questions or concerns about your medications, please do not hesitate to discuss them with your doctor or your pharmacist. It may be a good idea to stick with one pharmacy for all your medication needs. In this way, the pharmacist will know your medication history and can monitor any conflict with prescriptions. A dietitian will meet with you to give you information regarding a heart-healthy diet. For the first couple of weeks, you may find that you have lost your appetite. However, it's important to get adequate nutrition in order to heal properly. To do this, try to eat small amounts every couple of hours. A glass of milk and a piece of toast, for example. Keep healthy snacks and finger foods available, such as a cup of fruit or vegetables. As you heal, your appetite should improve, and the good habits you establish now will help you maintain a heart-healthy diet. When you go home, we would like you to continue to gradually increase your activity level. Make sure you alternate periods of activity with periods of rest. For the first week, you may find that your energy level is low and you are unable to finish an activity. If this happens, stop and rest, then complete the task. However, if you find that you've been resting for a prolonged period of time, get up and walk around a little. Pace yourself throughout the day. As you increase your activities, you may find you reach a plateau. Don't be discouraged. Keep active as much as possible, and you will find that you will start to progress again. Once in a while, you may find that you feel blue or excessively tired and weak. This is common, and if you need to retreat for a day, this is acceptable. If you find these feelings lasting for more than a few days, you should call your doctor. A more active intervention or medication may be needed to keep you on the road to recovery. Start your morning with a daily shower, not a bath. You may place a stool or stackable chair in the bathtub or shower to help you conserve energy. Make sure the temperature of the water is not too hot, as this may cause dizziness. When you wash, use a mild soap, one that does not have a lot of fragrance or deodorant. Use a clean washcloth and avoid touching your incisions with your fingers. This limits the amount of bacteria to which your incisions are exposed. Wash gently, rinse, then pat dry with a clean towel. Inspect your incisions each day for signs of infection, redness, swelling, tenderness, or drainage. If you notice any of these signs, please call the surgeon's office. Do not put any lotions, creams, powders, or antiseptic ointments on your incisions. Do not put any bandages over your incisions. Leave them open to the air. If you have a small area that drains, you may place a Band-Aid or a gauze pad over that area, but leave the rest of the incision open to air. Do not allow the incisions to be exposed to direct sunlight, especially during the summer months. Your incisions are sensitive and can burn easily. Make sure you get up and get dressed every day. This will help you feel that you are returning to your normal life. Wear loose, comfortable clothing. We recommend that women wear a bra, but try one size larger than usual. A gauze pad may be placed between the bra strap and the chest incision to help prevent irritation if necessary. After you are dressed, for the first week, you will probably need to rest for a few minutes. Then you can come downstairs for the rest of your day. Try to avoid climbing stairs more than once a day. If you do need to take the stairs, take one step at a time. Going upstairs, lead with your non-incisional leg, then place your incisional leg on the same step beside it before moving on to the next step. When going downstairs, you should lead with the incisional leg and then follow with the non-incisional leg. Think, up with the good, down with the bad, to help you remember. Once downstairs, set up a place where you can rest and relax. We want you to continue to cough and deep breathe using the cough pillow and the incentive spirometer or a cappella. Make sure you keep them nearby. You are still at risk for pneumonia and respiratory problems in the first few weeks at home. These activities will help prevent them. Your foot and leg exercises should also be continued, as well as wearing the elastic stockings during the day. You may remove the stockings at night, but ask a family member to assist you when putting them back on in the morning. These stockings will help prevent swelling and help prevent blood clots from forming in your legs. When sitting, your legs should be elevated. A recliner is ideal as it will elevate your legs to the level of your heart. However, a stool, coffee table, or couch may also be used. The walking program that was begun by your physical therapist in the hospital will continue at home. This is an exercise program, so plan time in your day for it. When you walk, try to stand straight and erect to improve your breathing. Start from a period of rest. Walk away from your chair for half the specific time and then back. For example, if your time period to walk is 4 minutes, you walk 2 minutes away and then 2 minutes back to your resting spot. You will gradually increase the time that you walk each day. Follow the schedule provided by the physical therapist. During your second week, you will also continue your foot and leg exercises, as well as coughing and deep breathing using your incentive spirometer. As your energy level improves, you may add more activity to your day. As you feel better, you may wish to do your walking program outside, but dress appropriately. Don't exercise outside if the weather is windy, humid, or very warm, or if it is raining, snowing, or the temperature is below freezing. Stay on flat level surfaces. Inclines and hills will increase the heart's workload. Your balance may be a little off, and your ability to compensate may be compromised, so try to avoid gravel or uneven surfaces. During the second week, you may also wish to take car rides. Try to limit them to less than an hour long. If you need to be in the car for longer than an hour, plan a rest area. Stop, get out of the car, and move around for at least 10 minutes. Then resume your trip. Make sure you wear your seatbelt and use your cough pillow as a cushion between the chest and the shoulder straps. If your car has a passenger side airbag, consider sitting in the rear seat to avoid injury to your breastbone in the event of an accident. You should not drive yourself for at least the first 2 weeks at home. Your breastbone needs to heal, and driving can impede healing. Your reflexes may also be slower due to fatigue and any pain medicine you may be taking. Your surgeon may advise you to wait even longer, so discuss this when you come for your follow-up visit after your discharge from the hospital. Over the next few weeks, it is okay to hug, kiss, and cuddle. This actually can promote healing. However, sexual activity should be avoided for the first 2 weeks. After that, you may resume sexual relations as your energy level returns. Many patients have concerns about resuming sexual activity. Please be aware that sex with a familiar partner in a familiar environment is as strenuous as walking 2 flights of stairs. After 2 weeks, your body should be sufficiently healed to tolerate this level of activity. However, medication can interfere with sexual performance for both men and women. If you are experiencing difficulties, please discuss this with your physician. After about 4 weeks, you may be ready for a cardiac rehab program. This is a structured, monitored exercise and educational program designed to maximize your recovery. Discuss this with your cardiac surgeon and your cardiologist to see if this is appropriate for you. A list of cardiac rehab programs in this area are included in your binder. After surgery, it is important to protect your breastbone so that it heals. Avoid pushing and pulling activities, as well as vigorous arm movements. This can cause a slight movement in your breastbone, which can delay its healing. So do not scrub, rake, mow, vacuum, sweep, or perform other similar activities. Use the heart pillow that has been provided to you for coughing and sneezing only. You do not need to use it when moving from the bed to the chair or walking. Do not lift objects greater than 10 pounds for the first 2 weeks after surgery. To visualize this, think of 2 5-pound bags of sugar or a gallon of milk, which weighs 8.5 pounds. This is not very heavy, so think before you lift anything, including children and pets. After 2 weeks, you are allowed to lift up to 20 pounds until 8 weeks after surgery. Follow the keep your move in the tube precautions for 8 weeks after surgery. These sternal precaution guidelines involve imagining that your body is in a tube and keeping your arms close to your side as pictured here in your handout. You may lift your arms inside the tube as demonstrated here. You may lift your arms above your head and out to the side to perform personal hygiene tasks such as putting on a shirt. You should avoid pushing or pulling your arms outside of the tube. You are allowed to push up from a chair as long as your arms are directly at your side. You can use your arms to get out of bed by using your elbow when you are on your side, as demonstrated here. Avoid bending at the waist. This can increase the pressure in your chest and put pressure on your healing heart. Ask for help instead. Avoid crossing your legs. This decreases the circulation to your legs and may predispose you to blood clots. Remember, these restrictions will continue for the next 2 months. Above all, don't smoke. This is essential to proper healing and future good health. Get professional help through your physician or cardiac rehab staff if necessary. For the first 2 weeks at home, we ask that you check your pulse, your weight, and your temperature daily. This allows us to monitor your progress. When you come to your follow-up appointment with the surgeon, bring your daily record with you. Check your pulse in the morning while resting. You can find your pulse by following the line of your thumb towards your wrist to be able to find your radial pulse. Count your pulse by feeling and counting the beats for a full minute. It should be between 60 and 110 per minute and have a regular rhythm. If it is less than 60 or greater than 110 or irregular in rhythm, please call the surgeon's office. Check your weight first thing in the morning after you have gone to the bathroom. We are looking for trends in your weight. If you find a weight gain of 5 pounds over 2 days or a weight loss of 10 pounds over 1 week, please call the surgeon's office. Because your body temperature varies according to a daily rhythm, we want you to check your temperature at 4 p.m. This is when your body is most likely to spike a fever. If you find your temperature is greater than 101 degrees Fahrenheit, you may have an infection and you need to call the surgeon's office. At the bottom of your daily record is a list of symptoms to be reported to the surgeon's office. In addition to changes in your pulse, weight, and temperature, please call if you have any shortness of breath, excessive fatigue or weakness, swelling or fullness in the abdomen, nausea, vomiting, unusual leg swelling, leg pain, or any pain that's not related to your incision, any redness, swelling, or drainage of your incisions. For patients who have had valve surgery, you must take extra precautions against infection. When bacteria gets into your system, it can settle onto your heart valve and affect its function. Tell all your healthcare providers about your valve surgery to ensure you receive appropriate antibiotic treatment before any procedures, including dental work, any invasive exams, or any minor or major surgeries. In addition, clean all cuts and abrasions thoroughly and apply antiseptic ointment. If you suspect you have an infection of any type, including lingering colds or flu, urinary tract infections, or vaginal infections, please contact your doctor for treatment. Depending on the type of valve, you may require anticoagulation therapy to prevent blood clots from forming around your valve. If you do, you should receive more information from the nurse on the floor that is taking care of you. We hope this information was helpful for you in preparing for your discharge home. However, if you have any further questions, please do not hesitate to ask the nurses and the doctors who are caring for you. Once you go home, you may contact the cardiac surgeon's office if you have any further questions. We wish you the best of luck and hope you have a speedy recovery.